Hey everybody, it's Rob DiNicola from Gesiva Medical, sales director in the East Coast of Latin America. Today's video, I want to go over something that's very near and dear to Gesiva's heart and my own: vacuum therapy systems, vacuum erection devices. These things are a lot more than Austin Power sex toys. They have a variety of different treatments that can be used or are treated with vacuum therapy systems or vacuum erection devices. They include erectile dysfunction, Peyronie's disease treatment of, and post radical prostatectomy rehabilitation. Those are probably three of the bigger ones, and there are some other uses as well for different kinds of surgeries. But one thing that we always try to talk to men about is that these things are far from sex toys. These aren't the things that you saw in Playboy growing up or in sexual novelty shops. They are actually FDA approved medical grade equipment used by millions of men to help them have sex or overcome some kind of disorder, and are very, very useful products out there. And sometimes, probably in the last 4 years, they've kind of fallen by the wayside a bit because Medicare stopped covering them. And a lot of the companies that actually sold and helped train patients went away. Recently, that's changed. Gesiva Medical was formed to actually help bring that back. There is another company out there that I used to work for that came back called Tim Medical, another very good company that has a good device. All in all, I think it's very good to get out there and make aware the need for these systems and help educate the patients and men on their options. So what I want to do actually is show you the device, how it works, and just talk about couple of different treatment options that these vacuum therapy systems do treat. So the Gesiva and most of the other vacuum erection device come in a nondescript travel case that actually holds the device. There are three main components to it. The first being a clear cylinder. This is actually where your penis goes in. And a vacuum's created. Second part is actually the vacuum handle. So this has a little motor in it that creates a vacuum and creates an erection. Forces blood into the penile body. Pretty cool. And the last major component, especially when you're using this for erectile dysfunction and you want to have sex, are tension rings. These go around the base of the penis to actually keep the blood in there. And that way you maintain an erection so you can have sex. So it's pretty easy. You basically put it together, and what you need to do is take one of the constriction rings. There's different sizes for different men and different tensions for different men, depending on how much tension you need to keep your erection. And you put the ring around the base of the cylinder. And you basically do that with your finger. Just manipulate it over, and it looks something like this when you put it on correctly. Once you have your ring on, you take the motor and put it in to the other end of the cylinder. So now you have a fully assembled vacuum therapy system. And almost all of the systems are similar to the Gesiva one in how they work and almost how they look. There are some very big differences in how effective they are. Better quality plastic, more volts of power. This has 4.5 volts, so it's actually a really strong automatic device. Automatic devices are the way to go because a lot of men who have ED tend to be older and have trouble using manual handles, which you need to pump. So this controls the amount of vacuum being applied to the penis at any and all times. So it becomes a very reliable, repeatable process for the guy. So with the device together, there's one very important thing that you need to do, and that is to use lubrication gel that comes with the device. And the reason why you need to do this is you need to create a seal. If the seal breaks, the erection will basically go away. So this is called aqua gel. It's a thick, viscous lubricating gel, unlike that of, say, KY that would use for like personal use for sex and masturbation. This is a lot thicker. They would use this in many surgical centers, and doctors' offices use this as well, just because it is such a very good product, and it's very cheap. So don't be shy using it. So once you actually have the device together, you want to put a good amount around the ring of the cylinder. That's going to create the seal. Don't be shy. Again, it's not cheap, and a lot of guys who do not achieve good results tend not to use enough of the gel. At that point in time, you basically just put it over the penis. I actually have an analog here. Pardon my arm. Like so. And you would pump. The best way to do it is how it would look on you. You would take it and actuate with any finger you want to do and hold it for about 3 seconds. 1, 2, 3, stop. Count to 3 again without pressing the button. 1, 2, 3. And then repeat the process. 1, 2, 3, stop. 1, 2, 3. Now it's going to take, 3, 4, 5 cycles to get the erection that you're looking for. You know your body, you know how big your penis is. So pump it until you actually have a full erection. Don't hold the button and just go for it. This can cause some discomfort, but the good thing about these devices, especially the Gesiva device, it's basically manufactured not to create so much vacuum that you hurt yourself, that you basically fill your penis too much. I always tell guys when I educate them on how to use it, it's not like it's going to be the exploding cigar in the cartoons. So at that point in time, once you use it properly, you have your erection, you take your fingers and you snap the band off onto your penis. So if you do it correctly, it should look like this. Probably a little farther down, but hard to do. As you can see, it totally constricts your penis, and you are able to have sex. Once you're done, you basically pull on the side tabs and pull it off. Done. Now, there are a few things that some men need to be aware of. One, you need to groom your pubic hair. You can't have a whole bunch of pubic hair down there because these are almost like elastic bands in some way. If you ever had an elastic band on your wrist and pulled it down and it gets caught in your hair, it hurts a lot. So too much pubic hair is going to probably not be fun when you take the band off. You do that once and only once. So think about being in the military. You want to keep that thing high and tight. Also, having trim pubic hair down there makes it easier to create the vacuum seal with the lubrication. So, a good thing. Another thing to be aware of. This is not kind of what you're used to in some ways. You've gone your entire life by just having stimulation, pretty girl, some kind of visual stimulation, and achieving an erection. Or maybe you went on to some kind of oral medication like a Viagra and Cialis, and basically the same thing happens. It's still a very natural process. You get some stimulation and you gain an erection. This is a mechanical erection, and not all guys like that because it feels different. You're going to see that the penis won't be standing up or have that verticality that we're used to with normal erections or when we're younger. When you get a really good erection, it kind of points right up at you. It may be hinged like this. Now it will still be erect. It will still be hard, but it'll be hinged because a third of the penis is actually inside your body. And with the vacuum therapy system, you only get blood into the part of the penis that has the constriction band on it. So it is a little different. The good thing is it still feels good. You can still orgasm. So all the great things that come along with sex are still there. It's just something to be a little bit mindful of because it is a little different. It's a mechanical erection, and that's not for all men. And the good thing is, there are other treatment options out there besides the Viagras, the Cialises of the world. I know they have the best marketing because, hey, it's great. If you can take a pill and get an erection, that's great. Vacuum therapy system is a good second line therapy for pills. Maybe every guy should have one just as a backup. But there are other treatment options out there, like injections, basically where you would take something that was either compounded at a pharmacy, or there are some prescription commercial injections for penises, usually a Prostadil, that you would inject right in the base of the penis that would cause an erection. What's different about them too is that you don't need stimulation once you actually inject yourself with in the penis. It forces blood flow down there, and you have an erection and are able to have sex. It sounds scary to have a needle down there, but those things do tend to work. You also have different kind of hormone therapies. Testosterone replacement might work for some men, and then at the end of your treatment options, you have a total penile prosthesis, basically an implantable penile prosthesis that actually goes into your penis with 2 cylinders that pump up with a little pump that's actually inserted into your scrotum. So there are many options out there. Vacuum therapy is great because it's a cheap option and it works for 90% of men. So you can almost always have sex with this whenever you need it. And the cool thing too is if you have a really good partner, you can make it part of your foreplay, so you don't feel so so different. I guess foreplay is really important in intimacy for a lot of men. Now, the great thing about it, like I said, is that these vacuum therapy systems are great because they're used for ED. So if you have ED and you failed on a pill of Viagra or Cialis, this is a great backup. This is going to work for you over 90% of the time. So it's a very effective, safe treatment option. There's nothing systemic. The only drawback is it is mechanical. So it is a little bit of prep work and it's a little bit different. So that really is the meat and potatoes of guys who actually use vacuum therapy systems. Another great use for this treatment option is for Peyronie's disease. So Peyronie's disease is actually the bending and curvature of the penis. So a normal penis looks pretty straight, maybe a little bit left or right. But for some men over time, they actually have a pretty severe bend that causes them to have a lot of trouble being intimate. Sometimes they can't even have sex, and it's just very uncomfortable and depressing in some ways. Basically, there's almost like a plaque buildup in the penis, and there are a lot of treatment options out there for that as well, which is great. There is injections, Xyloflex, basically, where they inject into the plaque and break it up by manipulating the penis. There is vascular surgery, not so common, but that is also available. And the vacuum therapy system is used for that as well, just without the constriction rings. There's no need for this because you're not having sex. And what they do is try to remodel the penis and straighten it back up by creating vacuum on it multiple times and basically fixing or correcting the bend and remodeling it by trying to break up the plaque. And a lot of times, vacuum therapy system is used along with some other treatment, usually injections. Another great use for it that there's a lot of studies out there that show it, and a lot of large institutions do have this, is penile rehabilitation after having your prostate removed because of cancer. Prostate cancer is pretty common for men. If you live long enough, you're probably going to get it. Most guys will die with it. But robotic surgery is a great curative treatment option. And many men who have prostate cancer choose to have their prostate removed through robotic assist surgery. Now, if the cancer hasn't spread too far, there's 2 nerve bundles around your prostate that really kind of control erections. They can spare one or both nerve bundles and try to preserve erectile function. Now, while a lot of surgeons are very skilled and are able to definitely keep both bundles, there's a lot of manipulation of the nerves, which creates neuroproxia, or basically short circuits the nerves. And without those functioning correctly, you don't get erections. And your entire life, you've been getting erections, even as a baby, when you sleep. And that is for penile health. When you have an erection, there's a lot of arterialized blood flow going to your penis, which is good for the tissue. After surgery, majority of men won't have any blood flow, at least arterialized blood flow in large quantities, going to their penis. And that's a problem, because what can happen is a lot of the space in those are called Lunica spaces. Think of a sponge, and there's little spaces in the sponge that, for lack of a better term, scar up. They can no longer accept blood flow, which is important to cause an erection. Without blood flow down there, you don't get an erection, or you don't get an erection good enough that it actually lasts long enough to have sex. A lot of guys who get older and who do have their prostate removed tend to complain about being able to achieve an erection, but it slowly goes away and deflates like a balloon, which is very frustrating. Just not getting enough blood flow in there to stop the blood flow from draining back out in the veins. Vacuum therapy system also helps with that. Basically done every day for about 10 to 15 minutes. It can mimic nocturnal erections and force arterialized blood to the penis, kind of preserving the tissue while you heal, which is great. That way, when your body's fully recovered, you should start seeing erections return, and it's one less thing to worry about when you recover. A lot of guys are frustrated when they don't really understand that a big side effect is erectile dysfunction after having a prostate removed. So being really proactive with rehabilitation using a vacuum therapy system. Some doctors use a gel or injections, PD5 inhibitors. There's a whole bunch of treatment options out there, but almost all of the really good ones include a vacuum therapy system as well. So, these things are seen as being sex toys, but they really are a phenomenal medical piece of equipment that helps so many men with so many different things, to help them with their quality of life. Because let's face it, it's all about being intimate with our partner and having that connection. And if you have erectile dysfunction, if you have Peyronie's disease, if you had your prostate removed and you're having trouble achieving erections, that's all very depressing and cause a lot of mental stress on the guy, but also on the couple. So, it's something that should always be on the forefront of your mind. If you suffer through any of these things, something that you should always talk to your urologist about, because these treatment options are out there. They are fairly cheap, and it's a one-time cost. And these things are warranted for 3 to 5 years, depending which company you buy them from. So it's one of the few things that the more you use, the cheaper it gets. So thank you for your time. If you have any questions, concerns, or comments, feel free to post and let me know. Thank you and have a great day.